I wanted to shoot this short video about what we call in the clinic paresthesia, which is nerve pain. So you may have heard of radicular pain or referred pain, and I think in general what people describe this as is, any numbness or burning or tingling that travels down an arm or a leg. And if you suffer from this video is for you. If you know someone who struggles with this, then you know what, share this with them, because this is going to help them immensely. So the way paresthesias work, so we call this like this numbness and tingling that can affect somebody's shoulder, that can go right down into a chronic elbow problem, or it can get right down into somebody's hand with numb fingers, has exactly the same root cause as pain that will travel down the leg. So if you understand how the nerve system works, the brain will be sending down a spinal cord, which is attached to nerves that are heading down into the arms and the legs. So if we think about that, there's your brain, spinal cord, and right out of your lower neck, you have nerves coming down the arm. Okay. When these nerves get pressure on them, you're going to feel either shoulder, elbow, or arm and hand pain, or all three of those if it's traveling the whole way down. Okay. So if we look at a model of the spine like this, the head is here, this person would be looking that way, and the spinal cord's running down the middle, but these are the nerves that I'm talking about. And especially these ones in the lower part of the neck, those are heading right down into the arms. And if we look at the lower back, it's a very similar picture, that these yellow nerves at the side are coming out of the spine and they're heading down the low back and into the leg. Okay? So why this gets important is if you've been struggling with any kind of nerve pain in the arms and the legs, almost every single case that's walked into this clinic, and I've been doing this for almost 13 years now, it stems from a misalignment in the spine. Now, these misalignments in chiropractic are called subluxation, so it's a specific shift or displacement of the spine that starts putting pressure on the nerves. And what this means is that you can have a chronic shoulder problem that's caused by your neck. You can have a chronic leg or foot problem that's caused by a problem in your low back. Now those are going to present quite differently, because if you have pressure in your neck on those nerves, well, some people may report that as a numb shoulder when they sleep on that side for too long. Okay? Some people may think that after typing for a while, their arm gets really tired, or they get some numbness and tingling way down into the hand that, they get up from the desk after a couple hours on the computer, they shake their arms and the pain goes away. And they go, oh, it's no big deal, that happens all the time. But clinically speaking, it's a huge deal, because what it means is in the neck, there is pressure on your nerve system as the root cause. When it comes to someone in a low back problem with nerve pressure, this can manifest itself as a chronic hip, chronic low back, sometimes even a chronic SI, sacroiliac joint problem. And if it gets progressive, yes, you can see numbness or tingling going down to the leg, into the foot, to the point where the nerves don't work anymore. People can actually lose control of their feet or their legs because that pressure in the low back gets so bad. So here's the Coles Notes summary. If you're struggling with any kind of radiating or pain traveling down the arms or the legs, the problem may just be coming from your spine, and the only way to get that assessed properly is to get your spine examined. Now, if you're anywhere in the Ottawa region, you can book in here anytime. Really easy to do. We do an exam. If I can help you, great. If it's a referral out, I'll refer you out. If you're watching this and you're not in our region, message me or comment below the video and I'll refer you to someone in your area who can help you by starting to take pressure off those nerves so you can get back to your full function. So when it comes to paresthesias, which are pain that travels from the spine down an arm or leg, I hope this helped you a lot, and I know there's hope for you. So reach out for help. Would love to give you any information we can. All right, take care.